Awesome. Well, so Dr. Joelle Fenger, am I saying that right?
Yes. Yep.
Okay, perfect. Well, thank you so much for joining me. As you know, I've recently started to create a company that my goal is like the ultimate goal of the company is obviously one to be successful and help people enjoy their time with their pets, mainly focused on dogs, and really just get the best out of every day with them. But with a secondary and honestly a little bit more primary for me is to help them understand education of how to be advocates for their pets, their dogs with hemangiosarcoma. I know you're very interested in osteosarcoma, and just other ways that they can advocate for their pets because the diagnostic and therapeutic options tend to be so limited. So, starting to make donations monthly based on sales to Ethos Discovery, because I was the lucky benefactor of an Ethos Discovery vet in my area just by accident. So
Yes.
I'd love to just talk to you about, all of your experience, why you got into it. So I'm just going to change my view here. Speaker view. Perfect. Okay. So thank you for joining me. What was it that inspired you to start to work as a veterinary oncologist?
Yeah, obviously in veterinary school, we kind of learn all of the different fields. And, I'm definitely sort of a scientist nerd first. And, an area like it's like oncology itself is certainly an area where there's a lot of sort of basic science that you have to understand, which was always interesting to me. And, what I had, as I kind of went through vet school, when I kind of learned about cancer treatment in dogs and cats. And I'll be very honest, as a vet student, I wasn't even aware of a lot of the specialties that existed. So it was a learning experience for me too. But, there were several things that really intrigued me and really got me interested in oncology. One was just, sort of seeing, what I think is really sort of special in this field is really kind of the bond that gets nurtured between, veterinary oncologists and their patients and the families. To me, I enjoy specialty medicine, but I really enjoy, kind of having, getting to know families, getting to know patients, and kind of supporting them through that journey. It's definitely a emotional process on honestly both sides of the fence, and so, I think that is a really unique aspect of veterinary oncology, just sort of the sort of, both medicine and then emotional sort of journey that you go through. And like many people, I have had very close family members that have had a diagnosis of cancer, and I've been through the gamut of treatments and sitting in oncologist appointments. I've seen even on the human side going to clinical trial screening appointments, and so that journey really resonated with me as well. And so I feel like that was something where at this, today, unfortunately, there's hardly a person that can say that they haven't, known someone or been touched by someone that has a cancer experience. And I think that that's really where like, that's how I would describe it. It's an experience, and it's from the beginning to the middle. And now we've talked more about survivorship too. It's an ongoing, like disease that you live with is what we hope to hear, so, those were the aspects that really drove me to it. I think it's a really special field. And, for me, it really balances my nerd side, but also the sort of compassionate care that I want to help, provide my clients with and, pet families with.
Okay. So when you're doing your trial work, what types of patients are you really focused on? What is your I think, do you do only osteosarcoma, or like what's your specialty that you really like to be focused in?
Yeah, yeah. So, in veterinary oncology, we certainly learn and get trained, and we learn all of the cancers, if you will. I personally see small animals, so dogs and cats, although, it's not surprising that cancer affects all sorts of animals. That could be, horses, zoo animals, tigers,
Okay, Yeah.
And so, there's certainly a wide range animal species that are affected by this disease. And so, my background and sort of, prior to joining Ethos, I had actually was faculty at Ohio State University at their veterinary college. And so, in that role, I actually had more of a primary research appointment and had a research laboratory that was studying bone cancer. And so, while that's an interest of mine, just from my own personal interest, when we practice every day, we actually do see all cancers.
Yeah.
And so, in human oncology, oftentimes they'll sort of, they are so specialized that they'll sort of send you just, to a particular specialist in a particular type of tumor. We're not there yet with veterinary medicine, although, everyone kind of has certain cancers that they probably have a little bit, personal personal interest in. But yeah,
You
we
do the
do
whole
see it
gamut.
all.
Okay. That's so I guess I never really thought about that. That's so interesting. So when you
Yeah.
were presented with a patient and you're diagnosing, different cancers, is there a treatment regimen that is standard across the board? Can you talk a little bit more about how you determine what the best treatment is and what your next steps are?
Yeah, yeah. And this is, it's always, has been, traditionally kind of modeled off of what the trends are in human medicine. And, in human medicine, obviously with just a larger number of patients and populations to sort of work with, there certainly are what you would consider standard of care protocols that there has been sort of rigorous evidence-based clinical trials that have demonstrated that, for instance, protocol A is better than protocol B for treating a particular cancer type. In veterinary oncology, oftentimes, we certainly have a lot of, published literature, that has sort of helped study and gain evidence or garner evidence in the field. But generally, our patient populations are smaller. We're striving to, kind of, at least include larger numbers of patients in each study, and then importantly, try to develop clinical trials that we can do in sort of what we call a prospective fashion, so that we can kind of start from day one and follow patients through their trials in a really in a very regimented way, if you will, organized fashion, in order to figure out if treatment A is better than treatment B. So I will say that in veterinary medicine, that's ongoing work. But because of the fact that the field still has some work to do, we honestly don't have a lot of quote unquote standard of care protocols. I'll be very honest though, that we kind of refer to the literature, and there's definitely the most common protocols that, for instance, people will use for the treatment of lymphoma in dogs. And so, you could call that standard of care. Although, when you compare that to the human oncology side, technically we don't have head-to-head trials for a lot of protocols, but there are very commonly used chemotherapy protocols that you could go from one oncologist to another, and they'd be very familiar with using that same protocol and probably prefer it based on the literature that we have.
Okay. That's really great to know. Sometimes when you start to get into these deeper questions, you start to worry, how would I know that I've chosen the right oncologist for my pet? But it does sound like there is some standard that you're working through. And then,
Yeah, there's
yeah,
commonly used protocols.
okay,
For some of the rarer tumor types, understandably, there might be, one report of that tumor in the literature. And, we do just sort of have to, that's when you really, really use the brain power. It's not uncommon that I will, be searching the literature, and I look at what they do on the human side in the same disease process, and try to, be creative. That's something that, I think the oncology community, as far as how we're trained, and it's a really creative community. So
yeah,
and then also it's always very, very common to phone your friends, and get what clinicians' experience is, which is helpful, to get a couple brains in the room. So
okay. And in your experience, because you work across all types of animals and all types of cancers, what do you see personally as potentially being contributing factors to why, say, let's focus on dogs. Why are dogs getting cancer in your opinion? I know a lot of it is genetics.
Mhm.
Are you seeing trends in food, or are you doing the research at all on what brings patients to you?
Yeah, that's the great question. It's like the $1 million question of like why we get
Yeah.
cancer. And it is a pretty challenging, even in our pet population, where honestly they're eating probably a much more regimented diet than, for instance, I am. Most of them are, have a pretty standard lifestyle, if you will. But it still ends up being really, really challenging to kind of determine whether or not there are dietary factors and environmental factors. And I think the fact that you bring up the environmental factors is really critical. And there is some ongoing work, particularly at University of Wisconsin has been doing, as well as like North Carolina State University have been looking at really environmental factors in relation to particular cancers like bladder cancer in dogs,
Okay.
which really actually has like really wide standing importance because we're sharing the same environment as our animals.
Yeah.
My cat is either walking across my computer or sleeping next to me on the bed, and so it is certainly something that that if there was something that we could uncover in what we call kind of a comparative oncology approach using both animals to understand human cancers and then vice versa, that that those would be maybe signal uncovering kind of studies where we could at least identify something and say, hey, maybe we should be looking at this a little bit more. um but those are ongoing studies, and fortunately we don't have the answers right now in terms of what particular things in the environment are maybe our animals getting exposed to, bringing home, licking their paws and stuff. But it is certainly like an active area of
Yeah.
research. And then, I think, what has been the biggest boom, in science in general is back to, genetics. And so, dog breeds, are very interesting because obviously dogs are very different. A Chihuahua looks very different than a Great Dane. However, when you sort of look at canine genetics, even between different breeds, it's actually a lot it's a lot cleaner in terms of when you look at the genetic background of dogs. There's certainly breeds that have particular genetic features that you can kind of differentiate a particular breed of dog from one other breed, but it's actually, from a genetic standpoint, a little simpler, if you will, compared to people, which are a pretty outbred population. Dogs are a bit more inbred, which is why we got, a Frenchie dog looking like a Frenchie and a Great Dane looking like a Great Dane. So, now that, that genetic tools really in the past 20 years have just exploded and entered the field. And then some really important work has been done, particularly by the MIT Broad. They've really worked on uncovering and actually spelling out the genetics of dogs. So essentially, what is the alphabet of like dog genes? And that was starting with what's normal, like what is actually normal in a dog population. And then from that, then they can kind of look at particular disease processes and start building out, hey, what is, where is the alphabet kind of mishmashed? And maybe how does that contribute potentially to seeing a particular tumor type be really common in like a breed of dog? So there are certain breeds of dogs like Bernese mountain dogs that happen to have a high incidence of a type of tumor called histiocytic sarcoma. And so, there's been some really, really nice work that has actually looked at potentially what is it about that breed and then that cancer, that maybe there's a higher incidence of it. And then, importantly, can we understand, from a genetic standpoint, if there's a contributor. At the end of the day, that probably goes back to the advocating, it would be great one day to, if you're really interested in burners, being able to sort of screen dogs and then, from sort of like a breed standpoint, point, trying to see whether or not we might be able to, kind of, breed a particular gene that we worry about being responsible for cancer formation. We could kind of breed it out of a population. So that's like the big picture, but that's definitely the work that's being done. And one thing that's been really nice is that, a lot of the genetic tools that scientists use, to some extent, you can use them on human, mouse, dog. To some extent, you can't. And so the availability of actually like reagents and genetic tools to be able to analyze the dog genes has really expanded as well. And that's, that's from the kind of bioscience sector, there's certainly been some groups that have really started developing the tools that our community needs in order to start answering those questions. So that's a real exciting area.
Very cool. So I have a red golden, and I did have a mutt, right? And I'd always heard that mutts had a better shot because they're not exposed to that inbreeding and some of those genetic factors. And so Max, my dog that died of hemangiosarcoma a year ago, when I was talking to Dr. Jake Colley last week, he mentioned to me that hemangiosarcoma specifically is probably the number one death-related cancer for golden retrievers. And I was like, no. But so if I am a pet owner and I have, a currently healthy animal, talking about the clinical trials that are available and wanting to help that process, because I don't know anything he has right now, twofold. Is there clinical trials that I should be enrolling him to help the research along now to track him? And then two, are there things that I should be asking my vet about my dog that they may not be screening for in their annual screenings?
Yeah, no, that's a great question. And, to be honest, the question of cancer screening and early detection, it's a really important one. So, we know that, say, like, again, back to kind of human oncology, there are certain screening tools that you can use for some cancers. So for, humans that have prostatic cancer, oftentimes there is like a blood hormone that you can actually screen for, the PSA, and look for that in the blood. I wish I could say that that was like the rule rather than the exception, but that's actually a pretty unique situation where there's something in the blood that you're able to detect in almost every patient, and that is like a pretty clean system.
Yeah.
Unfortunately, because in many cases, like, that's a hormonally driven cancer, and so it just happens to be one that we're able to have a good tool for. Because we don't have the greatest, like, what we call biomarkers or biologic markers that you can kind of take, screen for in any kind of liquid specimen, whether that's saliva, blood, urine. It does end up being very hard. So, there's certainly, I think at this time it's tough to have a really reliable screening tool, at least from like a blood biomarker standpoint. That again is an area where, there's a lot of, sort of research and development in particular platforms that might be able to answer that question. But, currently, like right now, it's really tough to have something that you can kind of pick up like a blood test for. And that, and it speaks to the fact that, we just don't really have the greatest, handle on a lot of cancers, and essentially they can behave totally differently even within the same cancer. And so it always ends up being a little bit tough, whether, if you went to the doctor every year and got a blood test, it's great if it picked it up for you, but if that test is not super sensitive, then it's also possible that you could get like a negative result back and say, yay, cancer free. But, if it misses, like 30% of the population, then it just ends up being an issue of is there a better biomarker that we could look for? So, that's certainly the work that's being done. At the moment, I think we're probably in the same boat as, kind of the current status of of humans with breast cancer, which is that, the recommendations to do imaging with like a mammogram is probably the most efficient way at the moment that we can try to detect lesions or masses early. And we do know, that makes sense. Like if we detect things earlier, maybe we can get on this a little bit sooner rather than later. And so, I think back to imaging, and that's probably our best tool at the moment, in terms of, I think, it just kind of emphasizes the importance of having like an annual wellness exam, that includes both, not just like a physical exam, but baseline blood work. I'll be honest that a lot of times we don't detect a lot of cancers on blood work, but it's also important just from the standpoint of kind of the overall systemic health. Maybe there's other things like kidney disease or liver disease that we'll pick up. And then, imaging that could be considered would be, something like taking some chest x-rays or abdominal ultrasound scan. I'll be honest that is kind of, it is a little bit of like a cancer hunt, if you will, but I certainly think, that's something that I'll offer, if folks are interested in, hey, is there a way for me just to kind of do like a screening, once a year. I think that's probably reasonable and kind of based on, what we have available right now. I think that's probably the best way to kind of screen things. To your question about, if you have a healthy doggy right now and, is there anything, that is going on? Research wise that would be, helpful, kind of in that screening area. One thing, just because you mentioned you had a little red golden, one project that has been a pretty massive effort is called the Golden Retriever Lifetime Study. And that has been an effort, really of what we would call more of like a epidemiologic or like population medicine study. And so, you bring up I mean, Golden Retrievers are an incredibly, wonderful and popular breed of dog, especially in the United States. And, unfortunately it is true that there are, aside the fact that we see a lot of Golden Retrievers just as our pets in general, they do seem to have a higher incidence of some kinds of cancers. So, hemangiosarcoma is one that's been recognized. And so the Golden Retriever Lifetime Study has actually been supported and kind of launched through the Morris Animal Foundation, which is and really what that project is just taking Golden Retriever dogs and following them through really kind of their lifetime, with the idea that at least that's sort of a population study where we get some more probably, prospective information about, so what are some of the like incidences of cancer that they're getting, what kinds of cancer are they getting, and really kind of, just sort of starting out by actually looking at like a population of dogs, a little bit more, and obviously there's a lot of questions that they can sort of answer and try to follow, not related just to cancer, but also just general aging and all sorts of older doggy diseases or conditions, so that's probably the largest sort of not screen, it's not really a screening trial, but just something where again it could kind of be, Golden Retriever dogs that are young, happy, enjoying a great life, and kind of following them through that.
Okay. Awesome. And as far as the research that you work on, are there any that you really feel like you're seeing a lot of advances and that you're close to getting a breakthrough on?
Yeah, within Ethos Discovery, we have a number of different oncology, kind of projects going on, and I think there are two I think are really exciting, and again, they're one is focused on hemangiosarcoma, and the other is osteosarcoma, which is a really common bone tumor in dogs. And these are big, multi-year studies, but with our hemangiosarcoma study, it's called the Ethos PUSH study. So that's the precision medicine umbrella study for dogs with hemangiosarcoma. Let's call it PUSH. But that is it's actually a study that's actually beyond hemangiosarcoma, if you will. And that's a study where dogs that are, this is actually, unfortunately a pretty common presentation that we see. A lot of ER clinicians will see is that dogs will present with an acute bleeding event, oftentimes into the abdomen. And when you kind of look to see where that bleeding is coming from, oftentimes it can be a mass associated with the spleen. And and so sort of the first portion of that study was enrolling all dogs, that presented with what we call a hemoabdomen or bleeding into the abdomen, and a splenic mass. And then, typically the treatment of choice, especially because it's an acute bleeding situation, is at least removing the source of the bleeding or the spleen. And sort of the first portion of that study was actually, again, back to telling us, how common or how at least particularly from my standpoint, if I was seeing these patients and kind of advising an owner on an emergency basis, I'd say, I don't have microscopes for eyes, but here's what I think might be going on. And the big question is always, is this a cancerous mass or is this not a cancerous mass? And sort of the traditional dogma, if you will, in veterinary oncology was what we called the two-thirds rule. And this was sort of some older literature that was really just looking at, like, on the kind of on a pathology basis, like what was the incidence, when you have a dog with a bleeding splenic mass, what is sort of the likelihood that it's going to be hemangiosarcoma? And so we used to say sort of two-thirds, which is like 70% or 67% of those dogs with a bleeding splenic mass would be cancer. And the majority of those, another two-thirds, are probably going to be hemangiosarcoma. And so, that's where we had first looked at this portion of this PUSH study to say, like, how real is that? And, can we use that information to start guiding and at least informing owners so that they can, understand and make their choice about, kind of choose if they would like to go to surgery or not. And interestingly, the first portion of that study had shown that there probably was about, close to 40. At some points, it's been up to like 50% of dogs with these bleeding splenic masses actually didn't have a cancerous mass. And so there are some benign tumors that can affect the spleen, and the spleen has a lot of blood supply to it, and so it can bleed. But the real important factor about that is that, if you have a benign splenic mass and we remove the spleen with splenectomy, that's essentially the treatment, and you're kind of cured of that problem. And so I think that's a real game changer in terms of sort of the conversations that, it's very different, from sort of when I, was training, and that now I think that we can actually sort of more comfortably start, telling owners a little bit of more realistically, like, what is this, what is that, what type of mass is that, do we expect that to be? And then I think importantly is that it does change the conversation a little bit, in that, there's certainly a distinct possibility that, that this, there's a decent percentage of dogs, 40 to 50% maybe, that may actually have a non-cancerous mass. And so, that would certainly encourage me to kind of, at least consider, hey, I think that starting with a splenectomy, while it's a bigger procedure, it's on emergency, but, that at least we could start there and then help figure out if this is actually cancerous or not, because, we potentially could be cured. So, so that was kind of important information. And that's really, was like the reason that we were focusing on hemangiosarcoma is, with Ethos Discovery, we talk to our clinicians at Ethos Veterinary Health, and, hold things like discipline meetings where we actually, say to them, what are some of the frustrations that you have? What is an unmet medical need that you feel like you need information for, so that you can better support, your pets and the pet parents. And, hemangiosarcoma was one that emergency clinicians, surgeons, oncologists all agreed that, like, this is a really frustrating disease, and any information that we could get would be really, really helpful for us, to help our, patients and their families. And so, kind of across the board, it was deemed a really, really important unmet medical need. So that sort of spearheaded the effort. Now, the second portion of this push trial is that it's so those for those patients that do end up having a diagnosis, their biopsy comes back and it's hemangiosarcoma, then we can kind of start, going from the oncology, putting my oncologist hat on, saying, hey, is there anything that we can do to change or improve upon, the current drugs that we're using? And again, doing that in kind of a prospective fashion. And so what we essentially have is that's sort of what we call the treatment arm of PUSH, where dogs that do end up having a diagnosis of hemangiosarcoma can then go on to the treatment portion of the clinical trial, where we actually have 4 different treatment arms, if you will, or 4 different treatment groups. Importantly, one of those treatment groups is sort of what we do consider the standard of care for, what we've been doing for hemangiosarcoma for the past 30 years. And so, it's, obviously, and then what we've done is sort of build upon either adding, combinations to that standard, standard therapy, or introducing totally new novel drugs. And so, that sort of from a treatment, standpoint, I think is helpful just in terms of figuring out, hey, is there something that we could be doing better from a treatment perspective?
Yeah.
And then really the last portion, which is the big portion, is sort of the information that we can glean off of, kind of cancer genetics and sort of the real science part of things. And so, while sometimes the technology doesn't exist at the moment, a big part of this trial is actually banking things like blood as patients are going through therapy, with the idea that, kind of, yeah, I think there's a lot of interest. Maybe we're not necessarily, we're not looking at anything like cancer screening, but what would be really important is, we typically will just sort of re-image patients in order to figure out if their cancer is responding to therapy, if it's progressing, and that's, x-rays and ultrasound. It's not perfect, and we know that. And so, that's where we've tried to pitch ideas. Is there imaging studies that we could do where we kind of, are able to use more accurate imaging to actually detect lesions that maybe we're just missing, on physical exam? Number 2, is there something in the blood that we, is there something that the cancer cells are shedding that we might be able to detect in a patient? And then, ultimately, the other thing that we have, which, is really precious, is sort of the tumor tissue itself. And so we've obviously collected at the time of surgery, patient tumors, and, importantly, answered a lot of different questions. So, if you're a surgeon and you take out a spleen and there's a big mass, we sort of section or cut that like a little bread loaf, submit portions of that for, for biopsy. And we've kind of looked to see, there's a concept or a term called tumor heterogeneity, which is a really fancy word for, it's like a Monet painting. There's like a bunch of little dots all over the place. It's not like this uniform population of cancer cells. And so, even from sort of a tissue sampling perspective, and when we're submitting samples to kind of get an answer or diagnosis on something, looking at different areas of the tumor to understand, at least from a genetic standpoint, what is potentially driving some of these cancers, with the idea that genetic information might help and that's the experiment, is that it might help inform, is there something that's driving these tumors, or that these tumors are kind of addicted to, that we might be able to think about like a therapeutic for. Or, perhaps it's something that we just know that, within a particular cancer, it's always interesting, but there's always really good responders. And we call them like exceptional responders. So there's some patients, and we've actually, been able to kind of, at least to the best of our knowledge, start trying to make benchmarks for hemangiosarcoma. And so, we actually asked the question of, what does survivorship looks like? So, and that's like a different term. So in veterinary medicine, we've traditionally talked about what we call median survival times. So we sort of say, well, on average, treatment with this drug, the average like duration of disease control and survival is going to be around here. But, there certainly is a bell curve. And so when you look at that, the other way of flipping that conversation would be, who are these exceptional responders? That essentially, what we know is that probably 12% of dogs with a diagnosis of hemangiosarcoma do seem to have survival times of like over a year. And that actually stays pretty steady when you get to like 2 years, although it's limited numbers. But what that suggests is that there is a distinct population, subset of patients that are really like exceptional responders. And so at least now that we have like a benchmark with like the drugs that we've always used, that's what we're sort of using in our push trial to say, hey, can we start bumping that survivorship percentage higher? Because that's kind of the important thing. And I think that discussion around survivorship is the shift to talking about survivorship. I think is a great one, because I think it's something that obviously we talk about on the human side quite a bit, and I think if we can bump up that number, that's another way to look at things. We're obviously still looking at median survival times as well, but what we would hopefully be able to do is, because we have all of these tissues, blood, from a collection of patients, what would be really wonderful is that once we, kind of follow these patients out, then we can kind of look at those population of like exceptional survivors or responders, and then kind of look back and say, hey, is there anything like, is there a blood test? Is there like a genetic test that we could look at? Because, certainly that would be, I think, really important. Obviously, as a pet owner, I would love to know what to expect. On the flip side, too, I think that, we know that there are some patients that unfortunately just, they have really resistant or aggressive disease. And so if you could tell me that, that maybe my dog was in this population or this like basket or bucket of patients that, doesn't really do well with our standard treatments, that to me would make me curious about, hey, maybe we could try something like a clinical trial drug or something totally new. You know what I mean? I think,
Yep.
so I think the hope would be is that if we're able to identify, a signal from some of these steps, that we there's maybe the opportunity to, again, not screen for patients, but maybe provide some, what we call prognostic tools, just to help guide, owners' decisions, which is important.
Yeah, and so what's really interesting about that is I have a Odie keeps coming to the door and then leaving, so it's super fun. As far as human cancers go, you're always looking for that hope, right? And everybody says don't go on Google because that median bell curve is not everybody, right? And so
Yeah.
my husband was diagnosed with rectal cancer, and it was like, you likely have less than a year, right? And he lived for 6.5 years. And so having that little bit of hope and knowing that there's that chance for me, when I'm bringing my dog in and you say, well, median survival is 4 to 6 months, I'm kind of like, well, why would I put him through this? But if there is 12%, might be in that group. So that's actually, that gives a little bit of hope, right, to those owners. Yeah, that's
Yeah, no, and exactly. And again, I mean, you're absolutely right. Having gone through the same, from family cancer experience, when you're there, you really, like, all you can do is have hope. And so I do think that, again, talking about the concept of survivorship is something that, like, we haven't really had, I think changing the narrative a little bit I think it's a, a really optimistic way, of thinking about things. And,
Yeah.
it's realistic. And, I think that at the end of the day too, is that that's ultimately what we want to see. It's really tough when you do have a number of clinical trials and, they're like, hey, this drug or this drug combination, it benefited patients, they had, their disease was controlled. It could be for a couple of months more.
Yeah.
It could be a couple of years more. It might be statistically significant, but it is a little bit different from, sort of saying, hey, what does maybe survivorship look like,
Yeah.
rather than kind of, and it still will take iterations upon iterations, but I think that we will have some really nice, like really foundational data, so that we can continue to sort of build upon iterations. And that's really what has, really, there's several examples, on human cancer where, they have sort of built upon, so like human lung cancer is a great example, where if you actually look at, the group of lung cancers, it's a subgrouping of, there's like over 10 different types lung cancers, depending on how you kind of break things down. And really that was a cancer where knowing genetic information broke down lung cancer even further. And so, they kind of they were able to do trials where they were able to say, hey, if you had this genetic mutation, we've now done a trial to look at a drug that's kind of good for your tumor type, or your, gene addiction. And that seems to be more effective than like their standard of care. And so again, that's, it's decades of work. But it certainly builds upon iterations of, and I know it comes back to, just understanding the tumor a little bit more, understanding all of those different subgroups that exist, and then, trying to continue to sort of modify the backbone of trials or treatments, or even offer, novel new treatments that seem rational for that disease. But, then you build that survival curve a little higher.
With all of the banking that you guys have done, it brought the question in my mind with, AI becoming this new thing. Is there an ability that you guys have, or will you be using AI to take a look at, all of the different specimens that you've had and compare it and contrast anything there?
Yeah, that's a great question. And AI is obviously, a booming field. I think in the medical field, the application of it is really where people are starting, and again, like where it should be used. Probably one of the earliest things that at least sort of AI was actually used in is actually looking at like biopsies. And so again, it was sort of looking at if you could basically train, like a program, or the computer, to look at all of these digital slide pictures. Could they actually, diagnose things like just like like a pathologist would. It's really, I mean, it is promising. It's definitely very early days. And so I don't think a pathologist is out of a job. And again, we recognize there's always like limitations. Obviously, AI is also trained by humans, and so we're going to ultimately be involved in that process.
Yeah.
But I think, what you bring up, like that, those are exactly the ideas that people have kind of, looked at. And to some extent, again, this is more on like the kind of basic research side of things, but there's some very special fancy stuff that you can do to, like, tumors, specimens that are on a slide, where you can essentially, look at different cell populations. So there's a cancer cell, but what we know now is that in order for a cancer cell to really kind of blossom and flourish, it needs a really nice home. And we call that the tumor microenvironment. And so, the cancer cell, it wants a lot of blood vessels so that it can get nutrients and blood to it, oxygen. It also wants to make sure that it kind of trains the immune system, if you will, to say, hey, make sure that you don't attack me. And then it needs its little bed, which is kind of like what we call like the stromal tissue or the connective tissue. And so there's been a lot of, just thinking of the application of kind of AI algorithms, if you will, is that there's been some really, really cool work where they've essentially looked at, can you recognize each of those different cell populations and then study them, on like a tissue sample, without having to dissect it all out, which is
Yeah.
really, really hard. So I do think that certainly it's probably more pathology based kind of research applications that AI is going to be, applied to first. And then, I think the question remains in terms of how it's going to be applied to kind of the practice of medicine in general. But definitely it's like a really interesting area to keep following up on.
When you are, I have so many questions, but when I think about as a pet owner and things that I want to know about, are there breeds that you see being healthier and avoiding these particular diseases, or for your own pets, for your cat, right? Like, and whatever other pets you might have, like, are you treating them differently? Are you feeding them differently? Like, what are some of the things that people can do to advocate for their pet and to keep them healthy?
Yeah. Yeah. And I'll be totally honest. I always tell people, I'm like, do what I say, not what I do when I go
Yes.
to my own animals. But that being said, my cat gets a lot of human food
Yep.
because his mom is not very good at, putting it away. That being said, I think again, at the end of the day, there hasn't been really enough data to sort of at least identify particular diets that are sort of better at quote unquote preventing cancer or not. And so actually just, going back to just overall, probably more so just about really joint health and overall health. We certainly see osteoarthritis in our pets. We can certainly see diabetes, and it can be like similar to humans, like type 2 diabetes. And so, from a standpoint, actually just of like the overall pet, I think, for diets, I mean, there's so many of them out there, but I do think that, as long as it's sort of, like commercial diets are still very good. I think that importantly, just like you look at your own food. I mean, I read my own like food labels. And
Don't do
so
that. Yeah.
I think that obviously having, purchasing from a company that's at least, reputable brand, that importantly, that you can kind of know the ingredients that are actually on the label. And then even more important than that is that, like your pet is actually enjoying the food and then doing well on it, so
Yeah.
I think again that goes back to sort of like the lean body weight and like obesity. And so there's always feeding sort of guidelines, but on the packaging. But I think honestly back to sort of like wellness, yearly wellness exams or every 6 months if you want, just kind of do weight check-ins and
Yep.
then kind of see like body condition scores, what we kind of call.
Okay.
So I think that's honestly the best, the best the best thing that I do.
That's well, and it's those common things that are good, right? Can I read all of the ingredients? Just last night I was reading ingredients with my daughter and she was like, I can't pronounce that. And I was like, then you probably shouldn't put it in your
Right.
body.
Yes, exactly. Really
Yeah.
vague terms. I know that they put, it's scientific terms in terms of, oh, this is actually like a type of sugar,
Yeah.
but yeah, if there's really vague terms like especially, again, not fragrances, but sort of like a
You can buy
natural
products.
blend of
Yeah.
whatever.
Yeah.
Honestly, that's something where, if I can't understand what ingredients are in it, then who really knows?
Okay. Yeah.
So,
That's good advice. Cause one of the things that I've talked with my vet about is I had Max on Purina, right? Cause she was like, they're doing really well. And he had a lot of allergies and he did well with
yeah.
that one. Now, as soon as Max got diagnosed, I had 3 days, but immediately I bought the farmer's fridge or the farmer's
Yeah.
dog. And
Yeah.
so now
Yeah.
he's on the farmer's dog. And I'm like, okay, well, I feel better about this, but is it going to make a difference? I don't know. You know what I mean?
Yeah. Yeah. Yeah, and again, there has been, they have looked at sort of nutrition for cancer patients, and it is really important, particularly for patients that are going through therapy, that it's not uncommon for them to kind of lose a little bit of lean body weight.
Yep.
I think their body is kind of, you get chemotherapy, it's recovering between treatments, but obviously, you are going to ultimately be affecting, like potentially dampening, the not the immune response, but certainly like the numbers of white blood cells,
Yeah.
and such. And so, the summary is that, there hasn't been really like like a diet that has been shown, that's like, oh, it's much better, patients, that they're, I don't know, they're doing better during their chemo on this.
Yeah.
The real developments, if you will, has actually just been diets that are more palatable for patients that are undergoing chemotherapy.
Okay.
So there is like a newer Hills, they call it Onc Care diet,
Okay.
and that is one that essentially the kibble itself has like a higher number of calories. It's a little more calorically dense. It's
Okay.
supposed to be a little bit more palatable, with the idea that we want to make sure that they're getting their like maintenance calories throughout therapy. It is not uncommon that, sometimes you have to entice your pets to kind of eat a little bit through chemo. And like it's fine if they're getting like their snacks or like this, the tasty
Peanut butter.
chew
Yeah.
like a couple of times, but they're really not supposed to be maintained on those
Yeah.
diets like really long term. I mean, if you like sort of like, you just shouldn't eat McDonald's like every day. But moderation is key. So
Yeah.
so we do want to kind of make sure that they at least have a diet that they're getting sort of their more maintenance like nutrient requirements, rather than these like they're tasty but like super high calorie, or highly dense. A lot of times they're super fatty and tasty is what the
Yeah.
appetite stimulants, or not appetite stimulants, but sort of what they call critical care formulas are. So ideally, if there's any kind of like maintenance diet that they're enjoying, then that's pretty much preferable for me. And the Hills Onc Care again is formulated just in that it's pretty calorically dense, but it is a well-balanced diet, so it should be good throughout maintenance. Now that being said, if a dog is eating, like if your dog's eating its Purina and liking it, then there's no problem, for them to stay on that. Honestly, there's not enough data out there for me to sort of say, hey, I feel really strongly about like advocating a diet change. It's just kind of more important that they like maintain their lean body weight, throughout therapy.
Yeah.
Um,
Awesome. That was a great little nugget there.
yeah.
As far as you personally and the vets that you work with, I know that you guys get attached to your patients. How do you deal with seeing them go through these trials and ultimately passing, and how does that affect you as a person and as a doctor?
Yeah, no, I mean, I think it's a really important thing. And, I think it speaks to like people really need to be cognizant of that. It's called like compassion fatigue, a
Yeah.
burnout, if you
Yeah.
will. And I think that is it's a very realistic and like inevitable stress that is going to be faced, by, whether it's like an emergency clinician, oncologist. But it is true that we, as an oncologist, I do have a lot of like end of life, decision making conversations, and they're not fun. They're not fun conversations to have. And obviously, I have patients that I've seen for years, and I consider them like my family too. Um, I think that it's really important to kind of recognize that, and I've been happy to see that the veterinary just community as a whole has sort of recognized and been more vocal about mental health awareness. I think it's a really sad statistic, but veterinarians actually have a very high rate of suicide, even compared to other medical professionals. And the reasons for that are unclear, but the fact that we kind of have at least that is like published data that that it indicates, we're now kind of on the searching mission to sort of say, well, what are some of the factors that, are contributing to that? And I have to believe that compassion fatigue is obviously a huge portion of that. To some extent, I'm sure it's the same, when you look at sort of hospice or palliative care in the human medical health field, is that is those are they're really tough jobs. And so, having an awareness of like that is a factor, and that mental health awareness is really important, I think is hopefully something that they're integrating more into like veterinary training nowadays. And as like a veterinary community, just sort of supporting each other so that when people do get burnt out, that like there's hopefully support systems, or even, company support, whether that's like, employee assistance programs so that people can seek out the help that they need. But yeah, I mean, I think it goes back to, certainly like ensuring that there's some, work-life balance, that people do take timely breaks. And it's hard, it's so much easier said than done.
Right.
But all I can say is that I think the fact that we're having a conversation about it more is totally an improvement from what I was in vet school a long time ago.
Yeah.
So I do think it's important, and for the all of oncologists, like it is definitely something where I'm like, it is okay to sort of just know that like this was a really tough week, and to reflect on that, and just make sure that like you're kind of keeping yourself in check, because it's tough. You can't be there for everybody.
Yeah. Well, and I know I've got you for 2 more minutes. What is one thing that you find yourself wanting to tell all your patients, or that you think is the most important thing for pet owners to know?
Yeah, I mean, I think in general, it's back to sort of the, hey, we know that dogs and cats can get cancer. What should I be looking for? And it's always really tough because hindsight is 2020, and you're like, oh wow, maybe this was happening and I didn't
Yeah.
really know. But honestly, I think that pet owners that are asking those questions, about like what should I be looking for, they actually probably know their pets much better than any veterinarian does. And so, even cats, we joke about like, oh, when a cat feels sick, it doesn't eat, it hides, and then it vomits. Like that's that's what they do. But at the same time, like as a cat owner, like my cat has a personality, he's got a routine. And so there are actually things like routines in their day that, while they might not vocalize and be telling you like a child would, like, oh, my tummy hurts, I do think that sort of just like if there's changes in their routine, those are some little things that it's very reasonable to say like, hey, I've been noticing this. I just
Yeah.
want to make sure that it is not like a medical problem. Maybe it's a behavioral thing, then it kind of goes to the obvious of, if there was, clearly abnormal signs like, oh, they're having vomiting, they're not wanting to eat, and it's not just like hey, my tummy hurts for 24 hours, and I got better.
Yeah.
I think it's just a matter of if there is a pattern that's sort of emerging, or if thing is just not resolving with like, nor kind of just diet change, eating a bland diet, then that's certainly when I'd say, yep, it's time to start looking a little bit further. But I do think that honestly, people do know their pets really, really well. And so their routine is actually a really good way to kind of monitor like, hey, what are the 5 things that they like love doing and that they kind of routinely do? And then if they're starting to do less of some of those, that's when I would start getting a little curious and say, hey, maybe we should figure out if something's going on.
Yeah.
I always say it's like pediatrics because our patients don't talk. Where their advocates are their owners, and between that, hopefully we can kind of figure some things out. But
Yeah. Awesome. That's awesome advice. I'm so glad to have a woman in science talking about all of this stuff.
thank
Like it's so
you.
empowering. So I really
Awesome.
appreciate you taking the time out today and sharing some information, and just really grateful. So thank you so much.
Awesome. No, I appreciate it. Really appreciate it, and really appreciate the work that you're doing. Because like you said, you've been on the other side, and it's a journey. And navigating through the process is never an easy one, but at least having sort of some advocates in a community, I think
Yeah,
is just, it's like the most important thing. So thank you for bringing awareness, and for helping Ethos Discovery. We're really hoping that we can feed this information back to the community and to pet owners. So it's all
awesome.
about the pets.
Yes, awesome. Well, I'm so excited to be helping out. So thank you so much.
Cool.
I appreciate
Cool.
your time. And yeah, I'll be cutting this up into little segments and I'll be sending it back to Tina. So thank you so
That
much.
sounds wonderful. And you feel free to let me know, like if you have any follow-up questions or whatever. I'm happy to help out how I can.
Awesome. Thank you.
Cool.
Well,
All
have a good
right.
rest of your day.
Okay, great. It was lovely to meet you.
You too. All
Take
right.
care.
Bye-bye.
Bye-bye.